and welcome to Trendlines, a podcast on global affairs brought to you by World Politics Review. My name is Elliot Waldman, and I'm an associate editor here at WPR. Before we dive into today's interview, just a quick reminder to tune in again on Friday for our editor's discussion looking at the week's top headlines. The death toll continues to mount this week in China from the Wuhan coronavirus outbreak. As of Tuesday, authorities in Beijing are reporting more than 106 deaths and more than 4,500 confirmed cases, although experts warn that number could be much higher due to a shortage of testing kits. Dozens of cases have also been reported in other parts of the world, including other countries in Asia and Europe and North America as well. After being criticized for a slow response, China is moving swiftly to contain the new outbreak, placing travel restrictions on more than 48 million people in over a dozen cities, including the central metropolis of Wuhan, where the virus is believed to have originated. Population, 11 million. The Director General of the World Health Organization says he is confident in China's ability to thwart the outbreak and has held off on officially declaring the virus a public health emergency of international concern. But will this response be sufficient to contain the disease? And what more can be done, not only to contain this, but also to prevent similar epidemics in the future? Joining me now to discuss these questions is Jeremy Youde. He's a WPR contributor, a specialist in global health politics, and currently the Dean of the College of Liberal Arts at the University of Minnesota Duluth. Jeremy, welcome to Trendlines.
Thanks so much for inviting me, Elliot.
So first things first, what's a coronavirus?
A coronavirus is something that most of us have probably experienced but haven't realized it. So for most people, your experience with a coronavirus is the common cold, because what coronaviruses do when they get into people is they generally cause respiratory illnesses. So headaches, runny nose, coughs, feeling kind of blah for a few days. And it gets its name coronavirus from how it looks underneath a microscope. It looks like it has a crown on top of it. The reason that coronaviruses have become more famous in recent years is because they're linked to two recent disease outbreaks, SARS and MERS. And in both of these cases, these were diseases that we hadn't previously seen in human populations and which showed a proclivity for being able to spread across international borders. And so it's that combination, the novelty of the disease and the fact that it was able to spread with relative ease that got the international community's attention and is doing the same now in this new coronavirus that seems to have originated in Wuhan.
So you mentioned MERS and SARS, and this crisis, it seems, is being widely compared, especially to that SARS outbreak in 2003, which killed more than 700 people in China and sickened thousands. How would you compare the government's response to this Wuhan coronavirus and that SARS outbreak? Are there lessons learned from 2003 that are being implemented now?
Well, I think one of the really key differences that we've seen this time is that the initial response to SARS was basically an outright denial, that the Chinese government was just flatly refusing to acknowledge that there was any sort of problem taking place within its borders, and therefore it didn't need the World Health Organization or other sorts of bodies coming in and getting involved in this process. And so it wasn't until months and months into the SARS outbreak that the Chinese government reversed course and said, okay, actually there is something going on, and there was some collaboration with the World Health Organization and other partners. There doesn't seem to be that same level of denial at this point. There are some questions about whether or not the government downplayed the initial severity of the outbreak, but we haven't seen this out and out denial. So we even saw today, we saw that the World Health Organization had a meeting with the Chinese government to talk about how they were going to be able to work together to address this outbreak, and that the Chinese government was going to allow for an international team of experts to come in and help assist with setting up some sort of effective response. So that's really one of the big differences that we've seen. The other key difference, though, is that we have seen this massive increase in quarantine this time. So as you mentioned at the beginning here, we've got somewhere in the neighborhood of 45 to 50 million people who are essentially being quarantined. And we have seen transportation systems being shut down. We have seen the flights to various parts from various countries and various cities to Wuhan being reduced significantly. Just this morning, the government in Hong Kong announced that they were going to cut off high-speed rail and ferry service to the mainland, and they were going to have the number of flights that were going to the mainland, all in an effort to try to reduce this spread. And their thinking is that if we stop people from moving, we're going to stop the disease from spreading. That's the theory, Practice suggests that that's actually not a super effective way to stop the spread of a disease like this, and actually ends up backfiring in a lot of cases.
How do you mean?
Well, one of the problems that comes up when you quarantine people or you tell people that they need to be restricted like this is that people tend to try to find ways around these quarantines. They try to find ways to circumvent these systems. And that becomes a problem because it means that people aren't being tracked. So it's hard to know if someone who may have been exposed to the disease, where they are now. B, it means that people are unlikely to access medical services because if they aren't able to get around the city very easily, and now they are being told they need to go in for some sort of monitoring, they're less likely to engage in those sorts of services. But then C, it also raises a level of distrust in the government writ large. And when there isn't that sort of trust, if people don't feel like they can trust the government, they have a harder time implementing those sorts of public health measures that can be effective in making sure that an outbreak like this doesn't spread any further than it already has. So it's one of those responses that looks like there's something happening, but actually tends not to increase the public safety.
So what would be a more effective response instead of quarantining people en masse?
I think a more effective response would be to actually implement a lot of the sort of public health measures that we know that can work. So thinking about things like contact tracing. So if you have been exposed to someone who comes down with a disease, keep an eye on that person. Make sure that you were able to identify when they are becoming ill, if they do become ill, and then you can put someone into some sort of isolation if they have actually become sick, as opposed to trying to keep 45 to 50 million people from moving around. You have an opportunity to just focus those resources on those people who are actually expressing symptoms. And this also gets to some of the questions that we have about this coronavirus, is that it's not entirely clear if someone has to be expressing symptoms in order for them to be infectious to other people. It's not entirely clear how long the incubation period is between the time someone gets exposed to the disease and when they would actually start to express symptoms. And so because there is that sort of ambiguity, it's actually more effective to try to concentrate those sorts of public health measures, have people going out into communities, building a rapport, talking about the sorts of measures that people can try to take to minimize the chances that they're going to be exposed, as opposed to just trying to put entire major cities on lockdown.
So what about internationally then? Would you say the World Health Organization's response has been appropriate?
I find the World Health Organization's response so far kind of curious, in that they seem to recognize that there is something serious going on here, but they have so far resisted declaring this public health emergency of international concern. If you think about that as sort of like the WHO's bat signal, a way to really grab attention and to get the international community on board with something that is new, that is novel, that threatens to interrupt international travel and commerce. This seems to fit a lot of those sorts of measures. So at this point, the World Health Organization and Tedros, who's the Director General of the organization, the top guy within the organization, have held off on making this declaration of a public health emergency of international concern. And their argument seems to be that this is a concern for China, but hasn't yet crossed that threshold where it's become a global threat, something that has potential consequences for the global economy or for international commerce and travel. What we've seen in the last week or so here since they've made that decision is that we are seeing the disease spreading into more and more countries. And we are seeing increasing numbers of countries recommending that people not travel to China. And we've even seen some countries trying to remove their citizens from Wuhan and from that area. So we are starting to see this international response, or countries feeling like they can't, that there might be some peril coming out of this outbreak. What would be helpful then is to have the World Health Organization really taking a stronger leadership role in this and helping to recognize this is something that we have the possibility of stopping before it goes even further. And so by not declaring a public health emergency of international concern, it's kind of letting the momentum fade away a little bit. It's not seizing the opportunity to try to address this before it gets even more widespread.
I love the metaphor of a bat signal. I think that's really a perfect way to describe it. But what kind of concrete measures would be put into effect by this declaration if the World Health Organization took that step?
When the World Health Organization declares a public health emergency of international concern, it doesn't automatically trigger specific resources. So there's not a bank account that's set aside, and all of a sudden this money can be released once this public health emergency of international concern is declared. What it does do, though, is it concentrates the international community's attention. It says this is something that is important. This is something that has the potential for really widespread consequences. And it's something that we need international collaboration if we're going to effectively address it. And so by declaring the public health emergency of international concern, it really brings an issue like this to the top of the global health agenda and to the top of the global political agenda. This is something that we need to take seriously. And while at this point, when it hasn't received that declaration, it's still a little bit ambiguous how other countries should respond, whether they need to get involved in this, what sort of a role they should play, and how they should partner with groups like the World Health Organization or other regional bodies.
One of the interesting sort of sidebar issues here is that China has for a long time opposed Taiwan joining international organizations like the World Health Organization and also the International Civil Aviation Organization, which plays a role in containing epidemics that can be spread on commercial airlines. So how does that hamper the sharing of information? And maybe you could also talk about the role of information sharing in an epidemic like this as well, in general.
Sure. So information sharing is absolutely vital because this is the sort of thing where, especially when we're talking about a disease that we haven't previously seen, we need to have as many eyes on this information as possible. We need to know as much as possible about what's going on, what's been tried, what is working, what isn't working, and just make sure that that information is flowing as freely as possible. So if that information is being blocked by governments because they don't want, they fear that they're going to have a bad reputation, they fear that other countries might retaliate against them for saying that there's an outbreak happening, that hampers our ability to know what we're getting ourselves into and to know how the outbreak may be progressing or changing over time. But you bring up a really good point about the relationship between the PRC and Taiwan in these international organizations. That's something that actually came up with the SARS outbreak because Taiwan had one of the highest number of cases of SARS anywhere in the world. And so the World Health Organization wanted to send its personnel to Taiwan to be able to provide assistance, to gather information, and to provide services. And there was a real contestation over that because the PRC initially opposed WHO teams going to Taiwan because there was a fear that that would lend a degree of legitimacy to the government of Taiwan as an independent political actor. So it took a lot of negotiation between WHO and the Chinese government before they finally got that permission to go in. And that's, that loses time. That allows for the outbreak to spread. And we've seen similar sorts of things happening in recent years where the Chinese government has opposed the observer status for Taiwan at things like the World Health Assembly, which is the annual meeting of all the member states of the World Health Organization. And so when you don't have that, when you have those political tensions that could potentially hamper the ability of that information to flow freely, it makes it that much harder for us to really put together a response that is responding to what is happening on the ground. You have to just instead try to intuit what might be happening, and that doesn't make for an effective international or coordinated response.
We might very well have some listeners who are about to travel internationally, perhaps even to a country that has had some cases of this new coronavirus pop up. What kind of advice would you have for everyday people who are traveling and who want to take steps to try to not only keep themselves from getting infected, but also just generally practice good public health and keep this from spreading any further? Sure.
And the biggest thing to keep in mind is that the chances of any individual person contracting this new coronavirus are still incredibly small. So if you start to come down with cough or sniffles or something like that, chances are it's probably more likely to be influenza or the common cold or something like that. So one thing to do is, even though this is getting a lot of attention, there's a need to calm down a little bit, I guess I would say. Don't worry that this is something that is going to take you out just because you happen to be traveling internationally. But there are steps that people can take in order to try to minimize their chances or to just practice good health in general. So, we know basic things like washing your hands, making sure you're covering your mouth when you are coughing, making sure you cover your nose when you sneeze, that if you do happen to cough or to sneeze, that you don't rub your eye, because that's a really effective way for the coronavirus to get into the body and potentially infect somebody. So there are those sorts of basic steps, good hand washing, good basic hygiene that people can take. But also another thing that people can do is make sure that if you haven't already, get a flu shot. Because if you are getting a flu shot, that reduces the likelihood that you're going to come down with influenza. And that means you're not going to be going to the hospital. And that then frees up those resources for other people who may potentially get ill with something like this coronavirus. So I guess the big message is this is unlikely to make everyone who's listening to this sick, but there are also just good strategies you can use for protecting yourself and the people around you by using proper hygiene practices and making sure to cover your coughs and your sneezes.
With apologies to our British friends, keep calm and wash your hands.
Exactly.
You wrote in a recent piece for us that given the tight link between animal and human health, it's really critically important to address deficiencies in animal health, especially in livestock and game animals that come in close contact with humans. And even though we don't really know for sure where this Wuhan coronavirus originated, it's believed to have been transferred from an animal to a human, right?
Right. That seems to be the going assumption at this point.
So in that case, your piece seems pretty prescient. So tell us a little bit about why animal health is such a big liability in the global health protection system.
The basic problem is that we don't do a great job of monitoring animal health, yet we know that the vast majority of human infections come from animals. And so as a result, if we don't see what's happening within the animal populations, we're not paying attention to what might pop up in human populations. And so that then also has these economic consequences, because part of the reason that there might be fear or reticence to acknowledge when there are outbreaks of diseases in, say, chicken or pigs in particular, is that people don't want to have those animals culled. They don't want to have their livelihood taken away. And so you've got these economic consequences. You've got this lack of surveillance capability that can effectively look at what's happening in animal populations, especially animals used for agriculture or for food. And the World Organization for Animal Health, is not super robust. It just doesn't have the sorts of resources, doesn't have the sort of personnel to really do the sort of work on an effective global basis. And so the other thing that comes up in this in this whole process is that there's not a single organization that really captures that human-animal health interface. So WHO focuses mostly on humans. The World Organization for Animal Health focuses mostly on animals, and those two organizations obviously work together. But there's no one who has that sort of singular responsibility who can look at and concentrate attention on what's happening between animals and humans and where those possibilities of disease transfer might be taking place. And so in the absence of that, it's hard to really know or to foresee where some of these outbreaks might be taking place or where they could potentially occur in the future.
So in addition to that, what are some steps you'd like to see taken both in China and by international organizations like the WHO to help prevent outbreaks like this Wuhan coronavirus from occurring again in the future?
Well, we're never going to stop all outbreaks. The microbial world has outsmarted us at every turn. But what we do want to do is we want to make sure that we've got systems in place, healthcare systems that can adapt and respond when outbreaks occur. So we need to recognize that countries can't really address these sorts of outbreaks on their own because we know how much people and goods travel across borders. So when something pops up in one country, it's likely to pop up in other countries. So it's important to build that sort of collaboration and strengthening organizations like the World Health Organization, which have a mandate to do exactly that. It's about making sure that governments are taking their international obligations to one another very seriously. All the members of the World Health Organization are party to a treaty called the International Health Regulations. And under the International Health Regulations, countries have an obligation to report potential novel disease outbreaks to the World Health Organization in a particular time frame. And they also then have an obligation not to retaliate against other countries that may be reporting disease outbreaks. What we've seen in practice, though, while the international health regulations have been in practice, is that countries don't always do that. And when they don't do that, when they either don't report information in a timely manner or they retaliate against other countries, that slows down the ability to make a response. And that makes it that much harder to address the outbreak. The other thing that I would say is that it's really important to build these sorts of systems that can adapt to a lot of different changes. We need to have preparation in place. Preparation isn't sexy. It doesn't get the same sort of attention. And it's the sort of invisible response, but it's the sort of thing that helps us to respond when these outbreaks happen in a very quick and timely manner and to stop these outbreaks before they get even further. So it's about trying to be ready and adaptable to whatever may come our way and making sure that we have international cooperation that's built up so that if something happens in one country, other countries can come to the assistance and they can have their systems ready to go and assist.
Jeremy, thanks very much for joining us today.
Thank you so much for having me.
Jeremy Youde is Dean of the College of Liberal Arts at the University of Minnesota Duluth. His latest article for World Politics Review is Now More Than Ever, New Strategies Are Needed to Protect Animal Health. If you'd like to comment on the discussion, ask a question, or even suggest a topic for a future episode, I hope you'll drop us a line at podcast@worldpoliticsreview.com. Trendlines is produced and edited by Peter Dury. You can follow him and WPR on Twitter, and while you're at it, don't forget to sign up for our free daily newsletter. It's the best way to keep up with what we're publishing, and you'll also get a code for a 25% discount off an annual subscription. To sign up, go to wpr.pub/trendlines. That's wpr.pub/trendlines. Thanks for listening, and tune in again next week.